My name is Diane Flores. I'm 44. I'm from Modesto, California. I am an owner of an all-women's personal training studio, and I'm also a coach for bodybuilding athletes. My first fitness competition was very intimidating. I had no expectations going in. I thought it was just going to be a one and done. I'm just going to kick this off the bucket list. It's something I've wanted to do since I had my daughter. I had two small kids, and getting on that stage, just like as soon as my heel hit the stage, I was like, this was a rush of just, I don't know, I belong up here. Bedside manner is super important for me in a plastic surgeon. My physician was phenomenal for that. She's well known in our town for having incredible bedside manner. She's also the only female around, board certified, and that was important to me as like a very female-based business and working with women. I thought, what better way to really share my experience than I also went to a female surgeon, and so that was super important to me. Her work was first and foremost the most important, so getting on her site and having the consultation was also really refreshing to see her befores and afters being very, very impressive, and a lot of my clients had great experiences with her. My consultation was great. She was very patient. She offered lots of options. She pulled out a variety of implants, allowed me to touch and feel. We discussed post-op care, who would be sort of my caregiver there afterwards, essentially the process post-op and how many visits I would need. She also discussed what my recovery was going to look like, how long I would be out of the gym. That was my biggest concern, of course, being in fitness. She went into length about, the risks and complications, made sure that I was fully aware of all those things, pre-op, post-op, and then down the line as well. This time around, I feel like since I've settled into my 40s, I'm much more confident and mature, and, I really want something that just give me a lot of upper pole fullness, a lot more fullness in the top. And so when I went in, that was definitely what I discussed with my surgeon, was I want more shape, I want more size, and essentially that's what we settled on. And so when I went into my surgeon, I was like, I want these. I want to look like this. And so that's sort of how we gauged the whole process, was honestly social media, really, more than anything, after I had client feedback on the local surgeon. So touching and feeling the implants on that consultation was a seller. Like, I knew immediately once I started touching them and feeling them. I chose Natrelle because when I looked at the before and afters, it seemed to be more in line with my body shape, my body structure in terms of the implants, the sizes. A lot of the marketing materials they felt very on brand for like just me as a person, and seeing the women that looked a lot like me in the brochures. There was a variety of women of different ages, shapes, sizes, and it was comforting. It was comforting to know, like, okay, this doesn't look, too far removed from women that would be in my studio or myself.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, example lupus and scleroderma, a weakened immune system, example taking medications to decrease the body's immune response, planned chemotherapy or radiation therapy following breast implant placement, conditions or medications that interfere with wound healing and blood clotting, reduced blood supply to breast tissue, clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.